Well, Simon, it's nice to meet you.
And you? Yes.
You're a medical student here.
Yep, I'm a fourth year medical student now
Here in Edinburgh.
Edinburgh. But you came to Edinburgh University yourself.
Too many years ago, back in 1964. I was here from 64 to 71. So it's a long time ago, a different time, a different era. I've never been in this room before. I'm told it's the artist's flat in the anatomy department. In your era here, in the last few years, did you see these drawings, these paintings, these illustrations? Because they were certainly up on the walls of the dissecting room when I was a student back in the 60s.
Yep, certainly some of them are downstairs and can be used as teaching aids. But it's interesting you say the dissecting room because now we do prosection. We don't do any dissecting ourselves.
So what's prosection mean?
So prosection means that the anatomists have already opened up the bodies for us into different planes, different cuts, and we come along with gloved hands and investigate them rather than doing any cutting ourselves.
So that's very different because in 1965, when I was doing anatomy, we had 4 of us to a half body, 4 on the other side, and we had to dissect every bit. Mm-hmm. And we didn't wear gloves, and we had to get our own instruments and scalpels and so on, and dissect away. And after we'd done a bit of the body, like the arm or the leg or whatever, there was the famous vivas on a Friday, and there were these rather strict trainee surgeons, registrars, who were acting as demonstrators, and they were pretty hard on us in those vivas, and we didn't really enjoy them. And that was every 4 or 5 weeks.
We have a different sort of style of teaching now. I think everything that we're taught comes in the systems. So we will do the relevant anatomy with the relevant system as we go through the course.
Right.
So that's something that dissection maybe isn't too useful because it's hard to dissect out the cardiovascular system. Mm-hmm. So we now have teaching specifically on that system that is relevant to the clinical material that we're learning. And we certainly have the preclinical years where we do more of the scientific and anatomy-based teaching, but it's very much connected with the relevant clinical material as we go through.
Well, I think that's a considerable improvement because we didn't see patients until we got into 4th year, and we certainly were doing anatomy with no relation whatsoever to what would go wrong with the bit of the body we were dissecting.
We do meet patients during the preclinical years, if that makes sense, whether it's through a linked GP practice or these kind of things that we are introduced to the consultations slightly earlier on. It's not just pure science for 1st and 2nd year for us.
How did you find seeing patients so early then?
Personally, I relished it. I think that it depends on your personality. I think some people worry if they don't have the scientific knowledge in the background to fall back on, that they don't quite know what they're saying. But personally, I found that it made it a lot more realistic and put it all into kind of perspective, that you would meet a patient who has the condition you're learning about almost. I found it quite useful.
We got of course, the Scottish Education Department gave us a grant, which was means tested, and it came to a maximum of £330 a year if you were a medical student, because you got an extra £10 to buy your textbooks because they thought they were so expensive. So we would nip across to Ferriers and buy often second-hand textbooks across there in Teviot Place, long sadly gone, I suspect. But it was enough. I mean, I stayed in Pollock Halls for 3 years, and certainly in 1st year it was £5 10 shillings in old money for a week, and that was everything apart from lunches Monday to Friday. You got fined if you didn't turn up in a jacket, 10 shillings at dinner in the evening, and you got fined if you 5 shillings if you didn't turn up in your tie at dinner.
So I'd be fined today.
you would lose 15 bob a time, I'm afraid, turning up at Pollock Hall's dinner. But anyway, that was different. It was enough, pie, beans and chips at the men's union, as it then was 1 and 9p.
Appearance is very much across the board a high standard thing now, especially with infection control procedures. So appearance is fairly uniform, and you would be reprimanded if you weren't appearing. So
what,
correctly.
do you have to wear white coats, sleeves rolled up, no ties because of infection control?
No ties, and also no white coats.
No white coats?
No white coats. They're reserved for surgeons who have to step out of theatre. But on the wards, we'll just be bare below the elbows in shirts, trousers, and female equivalent.
And no ties because they might...
Unless they're tucked in.
Tucked in, oh yeah. What memories do you have of the anatomy lecture theatre? Because I have to say I have memories of 40 weeks in there back in my 2nd and 3rd year. What was it like for you?
Certainly we had a lot of our anatomy teaching, the lectures, before moving up to the lab. were all delivered to us down there. And I very much enjoyed the theatre. I think going into it, especially as a first year new at university in a new city, it has quite a sense of grandeur about it.
Well, when I arrived in first year, we weren't going to get anatomy, but we had our first lectures down in that anatomy lecture theatre from the great and the good of the university, Sir John Bruce, Professor Sir John Bruce, who was the professor of surgery. He gave us a history of the Edinburgh Medical School, which was fascinating. I mean, he started off with the pre-Monroe and worked his way through. It was fascinating. He was very Churchillian, great presentation, an interesting man. The other lectures in that first few days were about medicine. We started off, we were coming into a profession, and there we were, 18-year-olds from high school. We were coming into a profession that went back to before time, back to Hippocrates and Vesalius, and it went through. So we got the entire history of medicine, and then we got these wonderful lectures on Edinburgh Medical School and why we were part of this institution which was going on and on and on. And then, of course, we didn't get back there until we had our anatomy lectures the following year. And every morning, 9 till 10, for a whole year, 30 weeks, and then another 10 weeks in third year for neuroanatomy. That was made tolerable by Professor George Romanes doing the anatomy of the brain lectures with his wonderful, chalked, personally diagrammed every bit of the brain for us. I can't remember very much about it, I must say, but I just was spellbound by his technique, and it was a nice way to spend 9 till 10 every morning for 10 weeks.
And in contrast to the teaching, from the chalkboard through to, the use of presentations and digital computers and everything, we've now seen downstairs the fantastic new anatomage system, which can bring the body into the focus in the front of the steep anatomy lecture theatre. And that perhaps that's the direction that anatomy teaching is moving in now.
It has to. When you look at it, you see that they're using images made up of radiographic type images from CTs and MRIs. And that is the way medicine is going. It's using modern imaging to do 3D reconstructions and so on. And that has to be the way, rather than just a sort of a muscle lying with a bone at one end and all this sort of stuff. It has to be done on the imaging basis, because every doctor, when they start practicing, is using those images. You have to bring it up on the screen. You don't get radiographs to put up in front of an X-ray box anymore. You have to sit there and download from the archive of that patient the images that have been created and put into digital format, and most of them are now cross-sectional images, MRI, CT, and so on. And you've got to be able to understand that and then put together what those little grey and black and half-white blobs and squidges mean compared with the living body that you're going to either operate on, or you're going to examine, or you're going to do, in my job, give radiotherapy to, and you've got to be able to put the two together. And so anatomy has to change.
Medical school is very much trying to bring these elements together so that we do use the cadavers, and that's a very important part that can never be removed from the teaching, but like the system that we've been seeing, it does add new dimensions to it in a very relevant modern practice of medicine. And having started your career here at the University of Edinburgh, have you had any regrets from making this your first step?
Not a single minute. I've enjoyed every bit of my career. The medical school was great. Looking back on it, I was a fairly boring, ordinary medical student. Didn't do anything very exciting, except have 2 very good trips to India. Once, the first time at the end of my intercalated degree in physiology, so I was teaching there for a summer, and then for my clerkship in 4th year. And that was wonderful, and I got money out of the travel fund at the university to help pay towards a bit of the fare.
Well, that sounds quite exciting to me.
It was fantastic. It was really eye-opening, particularly the clinical one. But I mean, teaching in a medical school there compared with here was, and doing a bit of research and so on, was great fun. The travel scholarship was a general travel scholarship, I think, for the university. I don't know if they still have it, but it helped me because to put together the money to go to India, although I was getting free board and lodgings there, I had to fly there and travel by train up to the Punjab. So since then, it struck me that I've had a good career, I've had a good life, and I've enjoyed what I've done, and a lot of it was because of the wonderful schooling I had in Kirkcaldy, and also the wonderful education I got here. So I put together a small amount of money each year to the medical faculty here as for a travel fund. If anyone is wanting to go to a particular third world country or to work with what are known as Aboriginal and Torres Strait Islanders in Australia, ATSIC, anything like that, where they're going to get a different experience and they need money, there is a small travel fund, and I think about 1 or 2 students a year can access it. If only one applies, I'm happy for them to have it all. Yeah. But I'm continuing to give that. And a few years ago, when they started the Access bursaries, I thought, well, I needed money when I was a medical student. I couldn't go back to my parents for money every week, except my mother did a lot of my washing and ironing, mind you. But I thought it was important to establish one of the Access bursaries, and the university dispersed that to a medical student in need. And
well, I'm sure that the students who receive that are very grateful, and it's really nice to see the cyclical nature of that. If you receive some help at your time, and there is now help available today for students in current circumstances.
And you, what's your plans?
Well, it's early days yet.
Yes, but you must have some idea.
At the current stage, I'm very interested in emergency medicine, anaesthetics, critical care side of things, acute specialties. I'm very much a doer. I like to do things with my hands and think on my feet. So that's the kind of field that I'm interested in at the moment.
So you're not going to be a physician, obviously?
Quite possibly not.
Well, take your time. I mean, you'll find things get interesting, and then you begin to realise that some things are less interesting. It's when you get into a specialty and you start seeing what it's like being with the patients and their families and the colleagues that you have to work with, not just in your own specialty, but with the other specialties. Then you begin to realise, oh, this is much more interesting. This is what I really can make something of. So,
well, it's been an absolute pleasure to hear about everything you've done. And it makes me sort of inspired to know that I'm starting off in a good place and there's a good road ahead.
Well, you are starting off in a good place, and I hope you get all out of it that you want and enjoy every minute.
Okay. Thank you very much.
Pleasure, sir. Really.